Increasing thoracic mobility with the quadruped position, doing thread the needle and wing to the ceiling.
We're now going to demonstrate the quadruped thoracic mobilization technique. The patient is started in a 90-90-90 degree position. You can see the ankles are dorsiflexed, the knees are at 90, the hips are at 90, the shoulders at 90, the wrists are at 90. I'm going to have him put his hand behind his neck and do something called threading the needle. And what I want you to do is bring your elbow between your knee and your other elbow and come back. And now he's going to go up to the sky, and I call that wing to the sky. Let's do that 3 times. And you're telling your patient that you want to see them go higher or lower throughout the different movements. Now, if his low back is hurting because there's too much rotation, he can park his butt right onto his heels. And you can keep the foot in the dorsiflex position, but if it's not comfortable, you can put your laces down towards the floor at this point to not be in dorsiflex, just so it works. Now let's do thread the needle again, and you're going to see if that stops the rotation in your low back. And usually people will say they can do this one if they have a low back problem. If the person has no low back problem, you can do it in the other position. Let's do your other side and compare how you do. So back to neutral, put your hand behind your neck, there you go. Thread it through and up and through. Almost looks like he has more flexibility on this side. Let's see how he does when he parks his low back in a safe position. That's great. Now I'm going to show one last thing. I'm going to ask the patient this time to close his left eye, and using your right hand on your neck, I want you to rotate as far as you can with just one eye open. Rotate as far as you can through threading and winging, and see if you can get a little bit of more distance. So basically, if you close the eye where you're turning towards, so in this case, close your left eye and you'll be able to thread more presumably. And then come back and close your other eye and switch eyes so that one eye is open. There you go. And then go back through and then switch eyes. And this idea is that you're actually having to go further. It's kind of an ocular cuing. Excellent. The reason why you want somebody to do this several times, like 3 and then go to the other side and back and forth, is because you're trying to really make sure that they gain some kinesthetic awareness of their movement patterns, that they kind of burn a neural groove, is what they say, so that he can become trained in the movement pattern. Thank you.